Yeah, that's good. The audition on my right ear is much better.
Recording in progress.
Hi guys, welcome and thank you for attending today's webinar. My name is Donna Chow and I'm your host and moderator for today's class by eLotus, your leading provider of TCM continuing education. We have been hosting educational courses for over 2 decades and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of continuing education. Today's webinar is From Theory to Clinic, Patient Analysis 2, presented by Dr. Hsin Lin. So the goal of this class is to make it feel like you are shadowing a teacher right next to them in the clinic, watching how they see patients and asking questions. We do this by using a telemedicine model that lets us see each other from a distance. You'll get the opportunity to see how Dr. Lin thinks strategically as he gives a diagnosis and treatment plan remotely, so that you can be able to do this for your own practice. Before he analyzes the case, we will provide the main complaint, a brief case history, and some background about the patient. Then he's going to ask some questions to help him understand the patient's symptoms better. Following the case analysis and prescribed treatment plan of herbs and acupuncture points, you, as a participant, may ask questions about the diagnosis, etiology, and rationale for herb selection. This is a golden opportunity to learn why certain herbs were ruled out for treatment and why certain prescriptions were made. So before we begin, I'd like to go over a few items to familiarize you with our webinars and how they work. Today's webinar will be from 9 a.m. to 11 a.m. Pacific time, and we're going to have one break. The first half of the patient examination and questions. The first half will be the patient examination and questions, and then the second half will be the formula and point discussion. To use the webinar chat room, set your chat preference to everyone so that everyone can see what you're typing and be part of the conversation. And if you have any questions for Dr. Lin, please, let's keep it organized and just type your question directly into the Q&A box. And finally, the quiz and the video replay, you guys will be notified by email tomorrow once they are available. So our speaker today is Dr. Hsin Lin, who earned a doctorate of medicine from China Medical University in Taiwan and worked as an associate professor in the Department of Traditional Chinese Medicine after completing a bachelor's degree at the same institution. He's taught for 12 years at this university and has been in private practice for over 20 years, specializing in difficult to treat conditions. He is one of the most knowledgeable and most patient speaker we have today. So let's go ahead and begin today's class and welcome Dr. Lin.
Dr. Lin?
Hi, how are you?
Hi, good morning.
Good morning.
Can everybody type in the chat room to see if you can see Dr. Lin and hear him fine?
Oh, okay, yeah, I can see the image. Yes.
Okay, great. Hi,
So
Dr.
everybody can hear me?
Yes, they put in
Okay.
the chat room. Yes, so
Oh, okay, good.
video, audio, both are good.
Mhm.
And today we have Diego here. He's our second patient for the English class. And Dr. Lin was saying yesterday, oh, the case is getting more complicated. So I'm sure Dr. Lin is able to help you. He's been in practice for
Okay.
30 years and he's excellent at this. The only difficulty is he's in New York. So some things that I'm just gonna have to help him, transfer the
Okay.
information. But
Perfect.
so let's get started. Okay. So Dr. Lin, can you start with your questions?
Okay. Diego, host,
Yes.
and everybody, how are you? I'm very happy to hear again. And today, we will collect Diego's information and analyze them. And this is first part. We will do this, and the second part we will discuss and analyze all the information and make the diagnosis and give Diego the prescription. Okay, so I hope today's course I can do my best and give Diego a suitable prescription and give all guys good information to help you to learn about this. Okay, so let's start it. Before today's course, I read Diego simply past history and some health information. So I'd like to know, first, can you describe about your problem about fibromyalgia?
Yes, I have started about 4 years ago with a generalized pain. It started out with my joints. It turned out to be several kinds of arthritis, but that wasn't the only problem. It also included a lot of pain on my muscles and different organs, actually. It's never the same. It always travels, it always changes. That complicated also with high blood pressure, cholesterol, and I have a heart condition since I was a kid. So at any one time, I am dealing with different kinds of conditions, ranging from joint pain to muscle pain to low oxygen level, probably due to my heart condition. So it is a kind of a complicated situation. Sometimes I don't even know where the pain is coming from.
Okay, good. So you just mentioned about 4 years ago, you have a problem about fibromyalgia. How about arthritis? Is it the same time you got another problem as well?
Yes, I would say I was aware of the arthritis about the same time when my wrists and fingers and left hip started hurting. It was diagnosed with osteoarthritis for the hip and different kinds of arthritis for my hands and shoulders. I also have a tendonitis and carpal tunnel syndrome in both arms.
Okay, so about the arthritis, does them happen symmetry? I mean, bilateral hand, the bilateral side?
Yes, both hands and now both shoulders. It was only my right shoulder, but now my left shoulder is hurting a lot. Other than the hands, also the wrists.
Okay, so about the arthritis, do you also have the morning stiffness when you wake up in the morning?
Yes, it's always the morning is always the most difficult time of the day. It loosens up a little bit as the morning goes on, but it never goes away completely. During the night, it's particularly painful when I get a lot of numbness of the arms, and the stiffness is usually there all the time.
Okay, so how about the temperature change? Is the temperature make the symptom severe when the temperature decrease?
My temperature, my body temperature?
No, the surrounding temperature.
Oh, I see. The weather. I would say that during the cold weather, it's a little worse.
Okay.
But since I have other conditions, the heat also makes me uncomfortable. But regarding the arthritis, probably the cold weather is not so good for me.
Okay, good. So does your did your doctor tell you about the arthritis is just degenerative or rheumatitis arthritis or any kind of this?
Degenerative arthritis, yes, he talked about that. He talked about osteoarthritis and also
rheumatic.
So,
yeah.
Yes. So he said it would not go away. It would just try to stop the progress of it. But I haven't had that much success yet.
Okay. So about the rheumatic arthritis, at least the doctor will make sure by a blood test to make sure the RA factor to make sure is the factor, the number, the data is higher or not. Because
yes.
If the RA factor is higher, there's one evidence for the diagnosis of the rheumatoid arthritis. So if you have not do the blood test, just feel pain and the joint happened, symmetry, morning stiffness, and when the temperature lower drop makes your symptom worse. Okay, maybe it's a stronger evidence. They are stronger evidence to support maybe it's the rheumatoid arthritis, okay? And the chronic, degenerative arthritis, most of time, maybe it's not happen symmetry, or the joint will swelling as well when you feel pain. Okay, so I just like to make sure your arthritis is degenerative or rheumatoid arthritis. So, are you sure what kind of arthritis you have?
I've had blood tests many times. Pretty much every couple months, sometimes every month, depending on how severe my pain is. So, yeah, the diagnosis is there. When you say degenerative or rheumatoid, I've heard the word rheumatoid several times from the doctor. So I'm pretty sure about that.
Okay, got it. So let's back to the fibromyalgia. The part of your body, is there any special part always happen frequently about the muscle pain?
The muscle pain is usually stronger in my legs and my arms, also in my chest. Because I have a heart condition, it's been kind of hard for me to know if it's my heart or if it's my muscles. I've been looking at my cardiologist lately, and he said that it's probably related to my fibromyalgia. So I would include my chest pain muscle to that also.
Okay, so can you also describe your heart-related issues?
Yeah, I was born with a heart condition that was corrected in 1967. It's an atrium septal defect that was corrected in 67. And I had no problem up until about 12 years ago when I had a heart attack. At that time, a stent was placed in my heart, and it's been fine, but the doctor feels that I need another stent. That's another artery that is blocked. So I'm scheduled for that in the next month or so.
So before 2 years ago, even you have a heart problem when you grow up, but there's no any symptom just before, 2 years ago.
No, 12 years ago.
12 years ago.
I had
Okay,
my heart
sorry.
attack. Yeah.
Okay.
Mm-hmm.
So you also mentioned that you have some issue about your high blood pressure and high cholesterol. So can you describe the process or the history about these two problems?
My high blood pressure started, at least I noticed this when my heart attack happened. Right after that, I've been in medication for that problem for the last 12 years. My high cholesterol probably has been there most of my life, maybe the last 20 years. I also noticed that ever since I had my heart attack. So also I'm taking medication for that.
Okay. So it sounds like because your heart attack, so at that time you start pay attention on your heart, the blood pressure and the cholesterol, right?
Yes, I would say so.
And the layer also got problems. So you take the medicine from 20 years ago about these two problems.
Yes. Mm-hmm.
Okay. So can you talk about I would like to know your blood pressure and your cholesterol so far do they under control?
Yes, it is pretty much under control while I'm taking my medication. I noticed about 2 years ago when I was having a lot of joint pain, and because I knew that might be a side effect of my cholesterol medication, I stopped for a couple months, and my cholesterol went up, so I went back on it. So yeah, I've been taking that, and while I'm taking it, I'm okay.
But when you take the medicine back, you start taking the cholesterol medicine again. How about your leg problem? Does that happen again as well?
The leg?
Yeah. You just mentioned after you take the cholesterol medicine, you got some problem about your lower extremity, right?
Oh, I see.
Yeah.
No, what I'm saying is I knew that the cholesterol medication might be causing a side effect of a joint pain. So
joint pain.
that's why I started.
Oh,
But,
okay.
I didn't know that my arthritis was there also. So I just went back on the medication.
Okay.
Mm-hmm.
So about your arthritis and the fibromyalgia, do you take any medicine for them?
I take Arava for the arthritis, and I take Lyrica for the fibromyalgia. I was also prescribed an Enbrel injections for my arthritis, but I haven't started on that yet. Frankly, I am afraid to take it because I have heard that it's very strong and there is a possible kidney damage with that. So I'm hesitant to take the Enbrel. I haven't taken it yet.
Okay. Yeah, I think the kidney issue is another thing. We will talk about that later. Because you have also have anemia, right? So
I was also told I have anemia, but I haven't seen the specialist for that yet.
Okay, so do you remember the blood test? How about the data of your red blood cell or hemoglobin?
It was low. Both
Okay.
were low. I don't remember the numbers, but I know
Okay.
they were low.
Okay. Away from the borderline, too much?
I would say not too much.
Okay.
I talked to a friend doctor to have a second opinion, and he said that it's not very low, although it's lower than the limit, but it's not too much.
Yeah. I'm concerned about your anemia because when people have a heart issue, at the same time, if people has the anemia problem, there's a possibility to affect your renal function. So so I suggest you at the same time you need to pay attention on your renal function. You can just follow up regularly, maybe every 3 or every 6 months to check your renal function one time. Okay. Yeah. And okay, let's talk about how about your blood sugar? Do you know about that?
My blood sugar is fine.
Yeah.
It's
okay, good.
One of the few things that are okay.
Okay, good. Okay. So okay. So I know you got a COVID infected in about June, right?
Yes, the first week of June, I got infected with COVID. It was pretty severe, I would say. I wasn't aware of how low oxygen level could get, but at night my oxygen level was in 80.
Okay.
I did not go to the hospital, and luckily the next morning, the sugar, the oxygen level was close to normal. So, but it lasted a couple of weeks, and I still feel some of the symptoms.
So did you check your oxygen level recently?
Yeah, it's been about 92, 93. And for an exceptional day when Donna did some acupuncture on me and the level went to 97. It was pretty amazing.
Okay, good. Yeah, I think the best thing is if you can elevate your oxygen level continuously to over 95. I think they'll be good. Okay, but I'm sure acupuncture is very beneficial for your oxygen level increase. Yeah.
Yes.
So I know you still have some pulmonary function disability, just like you have coughing, you have congestion, right?
Yes, I constantly have a congestion. The lung doctor told me that I have some scarring in my left lung, and that he thought it was related to the COVID infection.
Okay.
That he would see this in some of the patients.
Okay. So in addition to the lung congestion from the check, maybe from X-ray, I'm not sure, and you still have the coughing. So
yes,
let's talk about the coughing. Do you still cough recently?
I am taking regularly a decongestant, and if I let go of the decongestant, my cough and my congestion comes back right away.
Okay.
So yeah, I need to do that almost all the time.
Okay. So actually about the the respiratory function, about your pulmonary, about your lung, now seems just like you still need elevate your oxygen level, but the other symptom has gone, right?
Yes.
Okay, good. Okay. Let's talk about your daily habit, okay? Actually, about the fibromyalgia, most people have this problem, also have a sleep problem, or maybe they always feel anxiety or nervous, or maybe in the high stress work, or no matter any reason, just in the stressful condition. So I'd like to know, how about your sleep?
It's not good. I sleep maybe about 5 hours. I find my pain difficult at night, so it wakes me up. Also, my numbness of my arms wakes me up very often. So I would say, for the last maybe 5 or 6 years, it's hard for me to sleep overnight. So I get sleepy during the midday. I take a nap sometimes, but it's not the same. I feel tired.
Okay. So about the pain or numbness, the symptom become worse when you fall asleep at night. I mean, if you compare with the daily time.
Yes, I think it has to do with my posture too, my neck. I notice that in certain positions, when I'm sleeping or when I'm laying down or even sitting down, my arms get numbed. So when I move around, I change positions, that gets better, but not totally better. It's only for some short time.
Okay, good. So you just mentioned a very important information. If you, I mean, maybe move by yourself, do some exercise, your muscle pain will be better, right?
Yes. It is a kind of a catch-22 thing. If I don't move, my pain gets worse. So I need to get moving even if it hurts, because if I don't, it gets worse. So I try to balance both things.
Yeah, got it. So how about your arthritis, your joint pain? Is it the same condition? When you move, after the movement, you'll be better?
Yes, I do exercise with my hands and stretching exercise that I learned from my therapist. And I try to keep my joints flexible, but it's difficult sometimes, especially in my hands.
Okay. So so you mentioned actually you just only your quantity of sleep just about 5 hours every night, right?
Yes.
Okay. So can you tell me what time you go to bed? at night?
Oh, I go to bed maybe about 10, but I don't go to sleep until 1, maybe.
Okay. Because you cannot fall asleep easily?
I can't. I don't feel, I feel tired, but I don't want to go to sleep because that usually makes my pain a little worse or my numbness worse. So I kind of keep moving around to keep it controlled so I don't go to sleep.
Okay.
That makes
Got
sense.
it. Yeah, makes sense. Okay, so actually you really feel tired, but
Yeah.
it's not you cannot fall asleep because of not I mean it's not because your brain still running, no, but because of you feel body or your muscle, your joint pain, you need to make a move and make
Yeah.
sure it become better, right?
Yeah, usually by the time I'm so tired, I fall asleep, but I keep myself awake sometimes to try to control the pain or control the
Okay.
numbness.
Okay. Okay, so can I know what do you do now?
I am retired. As of last year, I took an early retirement from the school district, but I was a school bus driver for many, many years.
Mhm.
I had special education students that I had to deal with wheelchairs and stretchers and special equipment. So it was kind of physically and mentally challenging sometimes. So when I had the opportunity to retire, I just took it.
Okay. So now you have retired. So I mean, I like to know further. What do you do in your daily life now? Just fight with your pen, or do you do anything?
I try to help at home, take care of the grandkids. My wife and I are very much involved with our grandkids.
Mhm.
But to tell you the truth, there's a lot of things I used to do I don't do anymore, like work in the backyard or do all the repairs in the house. It's just hard for me to climb stairs
Yeah.
or lift heavy stuff because I also have a balance issue.
Oh,
I've
okay.
fallen a few times and I try not to do too much. Mhm.
Okay. So if you do some, homework, maybe repair something, or maybe you manage something, after that, maybe you do more movement, right? So after that, if you can you feel better about your muscle or joint?
If my activity is measured, I think it helps. But if I go over that, like for example, the other day I was trying to trim my tree using long tools.
Yeah.
That was really bad idea because at night the pain was so bad, my arms were shaking and all that. So it's kind of hard to reach a balance. So to keep active but not go over the limit.
Okay, got it. So another quick question about your joint affected by arthritis. How about their range of motion when you move them?
I've been having a lot of trouble with my shoulders, reaching back, lifting my arms too high. With my lower back, bending or, raising my legs to certain angles. And with my hands, reaching and grasping hard. So I like heavy, like something heavy. I try not to pick up anymore because sometimes my fingers will just give out and I let go. So I would say the range of motion is limited in some ways.
Okay. So it sounds like your shoulder range of motion is limited because of height. But
yeah, usually it's on my right shoulder. is to go higher than this. It's hard for me, or to
Okay.
reach back, to reach back with my right shoulder. And now I am feeling the same with my left, about the same. It's now actually my wrist and my left shoulder are giving me a lot of trouble
Okay.
the last couple of weeks.
So about your shoulder, maybe including elbow, maybe it's tight, but you just mentioned when you take a heavy thing, your finger seems like weakness. You will drop something,
Yes.
right?
Yes.
Okay.
Yes.
Okay. So, do you also search help for maybe not only physical therapist but also acupuncturist or chiropractor to, relax the muscle group around the problem joints?
Very little. Only lately I have tried to move away from traditional medicine to go into acupuncture or chiropractic.
Okay.
Many years ago, I had an opportunity to do some chiropractic sessions for my lower back, and that helped me a lot. Also, acupuncture helped me for balance. My ear, I had an ear problem, and that helped me a lot. So I'm really seeking different options now, because all the pills and the medications I'm taking, frankly, I'm tired, and it's making me have all the problems. So
yeah,
acupuncture probably a good choice.
Okay. Yeah, I'm really sorry for hearing about your treatment process. And but that is a evidence to prove maybe most of the medicine you have taken is not really focused on the problem is where the problem is. So maybe sometimes it can just decrease the symptom or make you feel better just a little bit, just a short of time, a while.
Yes.
So yeah, so I think okay. So today I think I will try my best to find maybe not conclude all the problem, but try my best to find the main problem. Okay. So if we can find the main problem and you just follow the route to deal with the main problem, I think you can maintain the health and make most of the symptoms become better. Okay.
Okay. Thank you.
Yeah. So okay. So let's back to the questions. Let me check. Okay. So actually, it sounds like your heart-related issue, maybe high blood pressure, maybe high cholesterol, they are under control because of you take the medicine, okay? And your blood sugar is okay. And about the COVID-infected issue, now just only low oxygen level. So let me make sure another thing. Back to the sleep. Do you have many dreams?
That's funny you mentioned that, because I was talking to my wife this morning. I was telling her that for the last month, I've been having dreams every night. Actually, I understand that we dream all the time, but we don't remember about it. But now I've been noticing this and remembering the dreams for the last maybe month or so.
Okay. So in addition to dreams, do you also notice your memory or your focus seems drop than before?
Yes. Yes.
Okay, good.
I have.
Okay, good. Okay. Hold on, let me take a note. Okay. So so do you still take exercise regularly? Not only just warm up or move your joint and muscle. Do you still really take a really exercise?
No.
No.
What I do is walking.
Mm-mm.
We
Okay.
walk maybe 3-4 times a week
Mhm.
around the neighborhood a little bit, but
Mhm.
I don't do any gym or anything like that.
Okay.
Mhm.
So about the walking, you know, the speed of the walking, just take a walk or you walk in a fast speed.
No, just a regular normal walk.
Mhm.
We used to do the quick, fast walking, but I noticed that it hurts my heels and my ankles.
Mhm.
So I stopped doing that. Just walking. That's all I do. Mhm.
Okay. Mm. Okay, so now I think I need to collect more information from your body. So I would like to ask the host to check your tongue and your chest and your belly. Okay.
Okay.
Okay. Thank you so much. So Tina, please.
Okay. Sam is gonna point with the camera. Maybe we close it. Okay. Wait, Diego, can you stick your tongue out? Okay, one more time for Dr. Lin.
Okay.
Okay, it looks to us live here with it's red with white coating. What do you
Mhm.
see, Donna?
Like looks the front looks dry, red with cracks in the front and the back, greasy white coating, and also the teeth marks. So
Okay, thank you.
Okay. Thank you. Okay. So the next one is the eyelid color.
Eyelid color. Okay.
Yeah.
Can you take your glasses off for us?
Mhm.
Okay, so just look into the camera.
Okay.
One more side.
Can you hold the other side first? Yeah, not focus.
Take a picture for document. Thanks. Okay, this side first.
Okay. Got it.
Okay, both sides.
sorry.
Okay. Okay. Got it. Thank you.
Okay,
Okay.
looks a little bit pale to us.
Yeah. So, excuse me, I'd like to ask Diego, put the tongue out again and turn up. I'd like to see
At the bottom of the tongue.
the bottom. Thanks. Please turn up your tongue. Yes. Okay. Okay. Got it. Thank you.
Okay, the bottom of the tongue, the sublingual veins don't look very purple. Looks actually okay.
Mhm.
Little bit.
I'll stick your tongue here.
So the bottom of the tongue doesn't have a lot of small veins either.
Okay. Yeah. Okay. So, before Tina check Diego's belly and chest, I'd like to ask the last one quick question. It's about the diet. So, do you take meals regularly every day?
Do you eat 3 meals a day?
I eat 2 meals a day, breakfast and dinner. I usually don't take any lunch.
Okay. So most of the time you eat at home, right?
Yes, most of the time, maybe once a week we eat out.
Okay. So maybe your wife cook from herself, right?
I cook.
Oh, you cook. Oh, good job.
Well, my
Okay.
wife also cooks, but I've been doing the cooking lately.
Okay, okay, good. So how about the taste, the flavor you did? Do you like the heavy flavor or spicy thing or greasy food?
Not spicy because my tongue is kind of delicate for that very spicy food.
Mhm.
But I like strong tastes, and I like fatty food. But I've been taking that out a lot lately, so I try to avoid the fatty food. But I like strong tasting food. Yes.
Okay, so sometimes you still take that, right?
Yes,
I
I
mean,
try to
yeah.
use maybe more salt than I should,
Okay.
or maybe I use a lot of pepper and
Oh, okay.
garlic.
Okay.
Mhm.
And do you like sweet food?
Yes, I do.
Okay, so lots of sweet food.
I like it, but I don't eat it as much anymore. I love
Mhm.
cookies. I take a couple cookies every day with
Mhm.
coffee, but
Okay.
not much.
Okay. So how about fruit? Do you eat a lot of fruit?
I take fruit every day.
Uh,
Banana is my favorite, but we have papaya and strawberries, and I have a guava tree that I eat a lot.
mhm.
So I
Okay.
always every day I have
Mhm.
some kind of fruit.
So okay, so you actually you eat fruit many kinds
Yes.
and every day, right?
Yeah,
So
I would
it
say.
sounds like the quantity is I mean more, right? You eat more fruit.
Yes, I eat more fruit. Yeah.
Okay. And how about the milk? Do you also drink a lot
No.
of milk? No.
Almost no milk. I can't stand milk that much anymore. You know, it
Mhm.
makes me
Oh, okay. Yeah,
sick.
yeah. Mhm.
I like cheese, but not milk.
Okay.
Mhm.
So how about your poop?
It's pretty regular.
Every
I
day?
take fruit juice every morning, and that helps a lot. I noticed that when I don't take my fruit juice, it becomes a problem, but it's pretty regular.
Okay. So if you take a prune juice, you can poop every day. But if you
Not
not,
not prune juice. Prune juice is too strong for me.
oh, okay.
Other fruits,
Oh,
I
okay.
buy other types of fruit.
Mhm. So you take fruits, you can poop every day. But
Yeah, yeah.
if you eat less fruit, how many days you poop once? Still every day?
I would say if I don't have my fruit, I can skip a day without not going to the restroom. But
Mhm.
um, it's very rare. I usually go every day.
Okay, good.
Mhm.
So is the stool shape like a
Is it what?
sausage?
The shape
Is
of
it,
the
It's,
stool?
it's normal. It's not hard or it's not dark color,
But it's
Mhm.
formed, right?
but it's yeah,
okay, good.
Formed, yes.
it's formed. Yeah,
Okay, good. So how about pee?
that's. I feel normally. I would say I get up to the restroom once during the
At
night.
night? Okay.
It's clear.
Mhm.
Um, Pretty normal.
Mhm. So it's also okay in the daytime, right?
Yeah, it's okay.
Okay. So how about the color of the urine? Light yellow?
Light yellow.
Okay, good.
Depending on what I eat, the
Mhm.
color might change, but
Yeah, most of
it's
time.
not dark.
Mhm. Okay. Okay, so that's it. So can I ask Tina to check Diego's belly and chest?
Okay, can you lay down, Diego? And then we're gonna show your.
Doesn't matter. Like this.
I take it off. You-
Okay.
All right. So is this angle okay, Dr. Lin?
Yes.
Okay, so for those of you who are new, Dr. Lin does the abdominal diagnosis on every patient. So what he briefly taught us is you want to look for the texture. So when you're first looking, you look at the texture of the skin, which then includes evaluation to see if there's any veins or discolorations anywhere. So from what we're seeing here, it looks okay, pretty even. And we just see like red dots here, there. And so the second T is we want to look for tension. So that's when you start palpating. Okay. And then the third T, 3 T's, texture, tension, and then temperature. So you start here. He said that when you are palpating the patient, your hands must be warm too. Don't touch the belly of the patient when your hands are cold. So we start here where the stomach is. And his belly is actually hotter than my hand. So it's warm, all on the side, warm. This side is cooler over here. So temperature, and as I'm feeling the temperature, I'm also feeling the texture. Texture feels smooth, it doesn't feel dry. And then down here, from the umbilicus to the pubic bone. Okay, Dr. Lin, cold here, cold here, and cold here. So cold on the 2 sides of the umbilicus. But down here is not cold. Up here is not either. So mostly here and here feels cold.
Okay.
Okay, so now we go in with pushing with a bit of pressure. So he says, push gently and just feel the resistance, if you will, all along under the rib. Does it hurt?
A little bit here.
A little bit here. Okay. Yeah. And ask the patient if it hurts. And if it does, then see if you feel any mass or anything. I don't feel any mass or tension. Both sides feel pretty even. Does it hurt on this side?
No.
Okay. Doesn't hurt on the right.
I would say from here to here.
From here to here, it hurts. It hurts here. So
okay,
I'm not
the right side under the cage, the right side's tension is normal if you compare with the left side.
Can you hold this for me? Thanks. This side feels looser, but around here, it feels about the same. But this side in general feels looser. This side feels tighter.
Okay.
Right side feels tighter.
But Diego feel the looser side hurt, right?
Yes, on this side.
This side.
Okay.
This is when you had the surgery?
Yes.
Okay. So did you have a poop this morning, Diego?
Yes.
Okay.
Oh, okay. So we're checking over here. It feels tighter down below here. But here it feels all okay. Doesn't feel like there's any tightness. There's no rod feeling. Does it hurt over here?
A little bit, yeah.
A little bit over here too.
Right there, yes.
Okay. So Diego, can I ask you a quick question?
Yes.
Okay. Do you like drink cold drinking? Or I like, taste the ice cream or something like that?
Ice cream?
Yes, I do.
Okay, so actually you eat or drink the low temperature thing frequently, right?
Yeah, I have my drinks with ice all the time.
Oh my God, that's too bad to your problem.
Our medicine.
Okay.
Yeah, okay. I think you need to do some adjustment. Okay, after the check, I will tell you this, okay?
Okay.
So Dr. Lin, I'm sure our audience is curious. What did I do in the diagnosis here that made you know that he likes to eat cold food and drinks?
Okay, so now after the palpation, can I ask Tina to do the percussion, the tapping for me?
Oh, okay.
Yeah.
So tapping, he wants to hear to see if there's sound. This one, it doesn't. Let me pick this up. I can't even hear myself.
Oh, more water.
Solid.
No, it's not solid. It's not only solid. There's some liquid sound in there as well, right? Can you identify that?
Yeah. Pretty solid, Dr. Lin.
I mean,
A little bit hollow.
is there liquid sound
Yeah.
combined with the solid as well?
Here, hollow. Let's go on this side.
Actually, I cannot hear any sound right now.
Okay, so here, here, and here, we have the hollow air sound, but not on this side. So mostly the stomach and the right side.
Mhm.
I hear more like there's air underneath.
Okay, so actually you can hear the air sound and then there's no liquid sound accompanied with that, right?
No, I don't hear any liquid sound, not like
Okay.
the patient.
Okay. So can you also check Diego's joint affected by the arthritis? About any joint he just mentioned pain. Can you check
Okay.
that?
Okay.
Is there any swelling or any red color or any, no matter acute or chronic inflammation sign around the joints?
Okay. So on the joints, which finger hurt the most?
These fingers.
These
Can
four.
hear here, right here, right here,
Mhm.
right here, on the left wrist,
Mhm.
shoulder.
Okay.
The index finger is a little bit deformed.
Mhm.
I wouldn't say it's severe at all. Looks a
Mhm.
little bit swollen, but not very bad. Does that hurt when you turn it over? Okay, it's painful when I turn his hands over.
Okay.
So it's a little bit swollen, but it doesn't look.
So I have a quick question for Diego. So in the past 20 years, you got the arthritis, right? In the past 20 years, the joint affected by arthritis, the outlooking are become more swelling than 20 years ago.
I think the swelling hasn't really increased for the last couple of years, but the pain has increased.
Okay, okay. So the pain is more obviously than the swelling, right?
Yes. Sometimes it looks like it's more swollen than it is because of the pain, but I think my fingers have kind of stationed on the swelling. Mhm.
Okay. So in addition to nighttime or you just keep the same posture for a long time, you feel hurt more, right? In addition to all of this condition, how about the raining days? Is the raining days make the symptom become worse?
The problem is we don't have rainy days in California.
Okay.
But
Yeah.
I took a trip to Florida
Yeah.
last week to see my mother.
Mhm.
And I noticed that it rains over there a lot. And it did really affect me a little more, yes.
Okay. Okay. So it sounds like there are many conditions can make the pain or the symptom about arthritis become worse. First one, maybe nighttime, okay? And the second one is maybe you just keep the same posture, you don't move for a long time. The third one is when the climate become humid more, all of the condition makes the symptom become worse, right?
Yes.
In your experience, in the past 20 years experience, just like this, right?
Yes.
Okay, got it.
Dr. Lin, his joints on the hands all feel warm.
Oh, okay. So about the temperature around your extremities, the distal part of your extremities, fingers or your toes, when the climate, when the temperature become down, the weather become cold, if you do you feel your distal part of extremity become cold as well? Very quickly?
No, my extremities, my fingers and feet are never cold, always hot. Actually,
Okay.
my wife said I feel like a heater all the time. I
Okay.
think it have a hotter temperature almost always.
Okay. Okay. So before we end the first part, I'd like to make sure. Diego, do you always feel tired, no matter you did a lot of things, or no, you just stay there? I mean, maybe you just sit on your sofa, read some book in the daytime.
Yeah.
Okay,
I've
so
been
actually
feeling tired almost all the time.
Okay, so most of the time you feel tired, right?
Yes. Mhm.
Okay. And did you afraid of the wind blow on your body?
Like when it's windy, do you feel uncomfortable?
Yeah.
Or
No,
you don't like the wind?
I do like the wind.
Okay.
Yeah, I like it.
Okay, got it. So, okay, I think I got all the information I need. So the last part is pulse taking.
Okay, the last part is pulse taking. The right tone is deep, wiry, forceful, and thick. There's not much resistance, or the bounce is not very high. The amplitude of the pulse is low.
Sorry, Tina, the signal is interrupted. Can you say that again?
Okay, so the right tone
Mhm.
is deep, thick,
Deep, thick.
wiry,
Mhm.
meaning it's tight,
Okay.
and it's not forceful. The guan is slippery, mid-level, and forceful. Ci is more superficial, kind of forceful. You're not supposed to feel the Ci position as much, but I feel this readily, and
Mhm.
it feels a little bit slippery.
Mhm.
For this hand. Okay, relax. Okay, the left tune. This is the heart. Dr. Lin, virtually no pulse here.
Oh, okay.
一点都没有哎 very
Yeah.
very low.
Yeah. Actually, the post like that just can present the question I just asked the Diego about the sleep, the dream, the memory, and the focus. Yeah.
Right.
Okay, go ahead. Yeah.
Yeah, there's not enough heart blood. It's pretty much no pulse. Let's
You mean
see.
Chun? You mean Chun, right?
Chun, yes.
Okay.
Left chun.
Mm-hmm.
Left guan the same.
Mm-hmm.
Yeah. It's a little bit more than chun, but it's very deep and very fine, very weak. Am I going cuckoo for cuckoo balls, Donna?
No.
You feel that too? That's the two sides are significantly different. It almost feels like two patients.
Yeah.
The pulse, I can feel a little bit, like a little thin, weak pulse. It's also very weak. Also, all three positions, I would say deep, weak, virtually non-existent. But the right side is definitely much more normal.
Okay. 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 So one more thing. I almost forget to tell Diego. It's about okay, I think you can sit up.
Okay.
Yeah. Okay, thank you so much. Okay, now I would like to sorry.
Yeah.
Everything okay?
He was fixing his hair for the camera.
Okay. Okay. Yeah. So the last thing I like to tell you is about the temperature of the food you take. Can you hear me? Oh, okay, good.
I can hear you.
Okay. Actually, in the TCM theory, we just like suggest patient avoid the low temperature thing. Okay, because the low temperature risk factor can hurt your stomach, your heart, and your just like your blood vessel. Because the low temperature thing, the risk factor can max your body tissue construction. Okay, so the blood circulation will be affected, and just like every organ, every tissue, every tiny part of your body need blood circulation, right? We need bring the nutrition from the blood or oxygen into your cell or your tissue, and take the garbage out, right? So everything, no matter food or drinking, everything low temperature can affect all the natural the physiological pathway and their effect.
Okay.
So obviously, you have the heart-related issue, you have the fibromyalgia, you have the arthritis. All the condition, all the symptom or disease like this, for us, for TCM theory, the most important thing, in addition to we do the treatment, we do the acupuncture or make a prescription for you, in addition to all of this, but also patient need to pay attention by themselves, watch out the temperature, okay? Yeah, so I think most of time, maybe you are still lucky, your energy is still good. I mean, just like you say, no matter summer or winter, you can make sure your body temperature, your distal part of your extremity can keep warm. I think that's a good news for you, okay? But we cannot just waste your energy like this. You just no stop, always take a low temperature thing, okay? It's a very, very huge risk for you.
Okay.
Yeah, so I ask you, in addition to I do the prescription for you, or the acupuncturist, or the chiropractor, or a physical therapist help you to treat all the problem. You need to do something for yourself. The first one, the important thing, most important thing is increase the temperature of your food.
Okay. All right.
Yeah, that will be good for you.
I'll do that.
Okay, thank you so much. And thank you for today, your cooperation and the information you offer.
Thank you.
Okay, thank you so much.
Okay, so we finished with the first section of today's class. Let's take a break for 5 minutes. 5 minutes or 10 minutes, Dr. Lin?
Maybe 10 to 15, okay? I need to figure out about this.
Okay.
Yeah.
Okay, so we come back at 10, 15. What is it now?
Okay, it's about maybe 1:10. Okay, 1:15. I'll be back.
Okay, so that would be our 10:20 a.m. Pacific time.
Okay.
All right.
Okay, thank you.
We'll see you later. And then
Okay, thank you.
Dr. Lin will talk about the case, the diagnosis, treatment strategy, herbs. Okay.
Okay, thank you again, Diego.
Thank you.
Thank you.
Recording stopped.